Hi, my name is Jordyn Young, and I'm a PhD student at the University of Michigan School of Information. In this talk, I'm going to present some insights from our paper titled The Role of AI in Peer Support for Young People, a study of preferences for human and AI-generated responses, which was co-authored by Laala, Jawara, Diep, Nguyen, Dr. Brian Daly, Dr. Jina, Huh-Yoo, and Dr. Afsaneh, Razi. Before we start, I want to note that this presentation and the associated paper do mention suicidal thoughts, which may be distressing for some readers. If you or someone you know is struggling or in crisis, help is available. Please call or text 988 or chat 988lifeline.org. Now I'll begin our presentation. Young people have unique social support needs and often turn to private online channels to ask for help. Some of the potential benefits of these interactions include increased quality of life, heightened perceived support, and increased self-efficacy. However, our previous research found evidence of what we call unsupport in such conversations. This happens when youth peers explicitly decline to give help or sometimes question the help seeker, which unfortunately leaves the help seeker's issue unaddressed. While friends or peers can provide knowledge of shared experiences that foster a sense of belonging and acceptance, they're not the only source of support in young people's lives. Adults, including parents, teachers, and mentors, can offer guidance from a more substantial range of life experiences and can serve as role models. Also, clinicians, such as therapists, have years of specialized training and can deliver professional, evidence-based treatment. Now a new evolution of technology is entering the landscape of online support, generative artificial intelligence, or AI. Most people are probably familiar with AI tools like ChatGPT and Google Gemini, which are large language models that can create human-like responses. Rather than replacing humans, we and other researchers are exploring ways to harness these models for human-AI collaboration. This application of accessible machine learning models can help in many ways, including by facilitating more empathetic conversations. Preliminary work is promising to suggest that AI-driven systems could aid in help-seeking online interactions by providing accessible, convenient, and personalized support to support givers. However, prior to our study, we lacked empirical data to understand how AI compares to the different types of human support young people encounter online, within the context of the topics that young people specifically seek support about. To address this gap in the literature, we asked the following research questions. First, what are young people's preferences regarding help-giving responses created by humans with various help-giving skills compared to AI-generated responses? And second, how do young people's preferences for help-giving responses vary depending on the topic of the initial help-seeking message? To answer our research questions, we analyzed survey responses from 622 young people about different responses to help-seeking messages from a dataset of real support exchanges between youth. We presented participants with 16 combinations in a 4x4 study design. The 4 help-seeking messages covered a range of topics that our team's previous research shows youth often seek online support about. These include relationships, suicidal thoughts, self-expression, and physical health. The responses represent the different sources youth seek support from, including peers, adult mentors, therapists, and now AI. We chose not to tell participants where their responses came from because we wanted to understand perceptions of the content as part of a peer support exchange, rather than feelings about the different sources of support engaging in the exchange. For each combination, we asked participants multiple questions to understand positive and negative responses to the proposed exchange. We also had a free response box for participants to tell us why they did and did not like certain combinations. To address our first research question, we compared the average quantitative responses from across topics and found that human-generated responses from an adult mentor performed the best. While participants did regard AI-generated responses highly, even above the therapist and peer responses, the adult mentor's responses were considered most helpful and most likely to be sent in response to the help-seeking messages. However, the results look a bit different when we look at the data depending on the topic of the help-seeking message, which we cover in analyses for our second research question. As I mentioned previously, our scenarios covered 4 topics that previous research shows youth frequently seek support about in online one-on-one contexts. From this research, the scenarios were relationships, suicidal thoughts, self-expression, and physical health. We found that participants preferred AI-generated responses to help-seeking messages about relationships, self-expression, and physical health. However, when the help-seeking message was about suicidal thoughts, participants preferred the adult mentor's responses. Given our limited time for this presentation, I can only discuss more detailed results for 2 of the scenarios, but please look at our paper to read about the rest of our results. When discussing relationships, participants preferred the AI-generated response more than any of the human-generated options. When asked to elaborate on this choice, participants noted that they liked the balance and empathy that the AI-generated response conveyed to invite the help seeker to share additional information without being overly intrusive or demanding. As one participant said, the response felt, quote, empathetic, supportive, and caring, end quote. This is not to say that the AI-generated response was without flaws. As one participant noted, the response seemingly, quote, accuses the ex without listening to his side of the story, end quote. While participants did note that the adult mentor's response also provided acknowledgement and validation, they also noted that it was potentially less useful and lacked clear direction. As one participant said, the response was, quote, beating around the bush and didn't provide a way of how to solve the situation clearly, end quote. In addition to coming across as understanding and non-judgmental, participants noted that the therapist's response felt like it delayed giving actionable advice. Also, despite not knowing the response came from a clinician, participants picked up on the, quote, professional, end quote, tone. They also did not like putting off giving help to the help seeker, noting that it felt like, quote, scheduling giving help to next time when the help seeker is in need of it now, end quote. We received the most negative comments about the peers' response, which participants felt was terse, suggested hasty action, and was not encouraging. As a reminder, this message came from the actual dataset of peer support exchanges, so this is what a real peer sent in response to this same help-seeking message. As one participant noted, this response, quote, sounds harsh and rude, end quote. The help-seeking topic of suicidal thoughts was the only one for which all human-generated responses outperformed AI's response. Participants liked the adult mentor's response the most, noting that they liked how it conveyed genuine concern by inviting the help seeker to share more details and put effort into providing more support. As one participant mentioned, quote, there's a feeling of care and that they're really interested and want to understand the individual and their situation, end quote. Participants felt strongly about the peer response and noted that it felt superficial, inconsiderate, and did not sufficiently acknowledge the help seeker's struggles. One participant even described it as, quote, typical of a bot, end quote. Next was the therapist's response. Once again, despite not knowing the response came from a clinician, participants picked up on the professional tone and thought that it, quote, doesn't feel friendly at all, end quote. Last is the AI-generated response, which performed the worst for this topic. Participants took issue with how the message referred help seekers to a healthcare provider because it felt like the message conveyed less desire to help in the moment. As one participant said, quote, fine, you can't provide help, but that's not the best way to put it, end quote. Our study points to several important areas for discussion regarding AI-powered peer support, including questions to address about handling sensitive topics, should they arise. Our findings about participants' positive reactions to AI-generated responses provide a premise for using generative AI to assist help-giving individuals in support-giving conversations. Building on prior literature to suggest that AI can help users craft more empathetic responses in general, we can use our findings to motivate future research that deploys generative AI in help-seeking situations, particularly between youth. Importantly, we do not mean for our results to imply that AI-generated content is sufficient to replace a therapist or clinical expertise. As we found, participants did not like AI's response about sensitive topics, for which the response specified that the kind of support required was outside of the model's capabilities. However, participants' feedback that the response felt dismissive is constructive for building future iterations of these models. Researchers have begun to explore how AI should own up to its faults during user interactions, and our work highlights that similar frameworks should be explored for sensitive topics. For example, how can AI convey its limitations constructively while ensuring user safety in response to potentially dangerous disclosures, such as suicidal thoughts? I'd like to end this talk by highlighting our key contributions. First, our paper provides insights into how young people perceive AI-generated responses in peer support situations. Our results also identify the popular conversational topics among young people where AI-generated responses are and are not well received. Our findings also bring implications for designing AI-powered systems to safely and effectively help youth during online support interactions. Thank you for your attention. We invite you to explore our paper for further insights into young people's preferences for human and AI-generated responses in peer support situations, as well as our thoughts on designing AI systems to support sensitive exchanges safely and effectively. We look forward to connecting with you either during or after the conference and encourage you to reach out with any questions or comments you may have.